Let's talk about removing central lines. Removing a central line needs to be done by a nurse who understands the procedure of how to remove a central line because it can be a dangerous procedure if it's not done correctly, but we're going to talk about all the steps. Of course, check with your hospital's policies. I'm going to talk about the basic steps here, but your hospital may have a little bit of a variation. Before we go ahead and even remove a central line, we need to make sure that we have an order from a provider and that it's safe to do so. We need to check the patient's coagulation factors to make sure we don't have like a super elevated INR, super low platelets, or they aren't on any extreme blood thinners. Like if they had just gotten TPA, you're not going to remove a central line. We also want to make sure that the patient isn't currently running any medications through the central line that can't be moved to another line elsewhere. Removing a central line is done aseptically, but you will see some hospitals that require it to be removed sterilely. So just make sure you're reading into your hospital's policy. So once we know it's safe to remove the line, we have the order to do so. We're going to gather all of our supplies. The supplies I like to grab are one transparent dressing. I like to grab a couple 2x2 gauze packs. I also like to grab some petroleum gauze because this is going to really help you get that occlusive dressing once the site has stopped bleeding. I'll grab a chlorhexidine swab so I can clean the area, and if you need any sterile scissors, grab those if you're going to be cutting sutures. I'll wash my hands, I'll get my gloves on, I will prepare all my equipment, so I'll open up everything that needs to be opened, and I like to prepare my gauze that's going to be used to hold pressure initially. And I also like to prepare my dressing that's going to be going on the site once the bleeding has stopped. Personally, I like to use a transparent dressing. Then I will use 2x2 gauze, and then I'll put the petroleum gauze on top. That way we get a nice good seal. You're going to want to make sure your patient's head of the bed is flat. And if they're not able to follow this and lay flat for up to an hour after you remove the line, definitely coordinate with your provider to see if there's something you can do medication wise, or if we can do something to keep the patient calm. Once the patient's flat, I've got all my supplies ready. I'm going to go ahead and start removing that dressing, and I'm going to use a chlorhexidine swab to kind of remove any securement devices, kind of clean the area, making sure it's nice and clean prior to me putting the dressing on. And you can use your scissors to cut the sutures. When you go to remove the line, this is a great technique. You're taking the sterile gauze, holding it over the site, removing the line, but you're going to want to make sure you do this at the end of expiration, or just have your patient hold their breath. And if your patient is vented, then you are going to want to perform the removal, pulling the line at the end of inspiration. Once you pull the line, you're going to hold pressure with that sterile gauze for about 5 minutes. Don't peek, give it 5 minutes so you can really get that bleeding to stop. If you're culturing your line, then you're going to want to make sure you have a place to put it so it doesn't get dirty. And once the bleeding stopped, I will put my petroleum dressing on. So again, transparent dressing, sterile gauze, petroleum. So the petroleum is going to be touching the skin. Make sure you get a nice occlusive dressing on the outside, and then keep your patient flat for about an hour. And that's it. Let me know if you have any questions.